Hello everyone and welcome to the Listening Show. I'm your host Yao. Now listen to this. The National Health Insurance, or NHI, in South Africa is a healthcare financing system designed to provide all citizens with access to quality healthcare services. On the 15th of May 2024, the NHI bill was passed, marking a significant step towards the implementation of this new system. From a developmental finance viewpoint, the NHI aims to address economic disparities in healthcare access and create a more equitable system. Currently, the healthcare system primarily benefits the employed, middle and upper income groups through medical aid schemes and hospital cash plans, leaving low income groups and the unemployed without coverage. Now, the NHI seeks to bridge this gap by ensuring comprehensive coverage for everyone, regardless of their financial status, which is very important. Now listen to this. Healthcare is a fundamental human right enshrined in the South African Constitution. Yet the current system remains skewed, resulting in the majority of the population lacking access to quality healthcare. The NHI represents a bold attempt to rectify this imbalance, but the question remains, can it truly deliver on its promise to provide affordable quality healthcare to all? From a financial development perspective, eliminating profit motives and exorbitant fees in the private sector through the NHI could lead to more cost-effective healthcare. However, critics argue that the system may be more expensive and challenging to sustain than anticipated. Now listen to this. Contrary to concerns, the NHI will not abolish medical schemes. Individuals can retain their private insurance if they choose, but participation will be mandatory for all citizens in the NHI. This dual approach ensures that everyone has comprehensive coverage while allowing the private sector to continue operating. Yet, will this mandatory participation foster a sense of unity and fairness, or will it create further tension between the different economic classes? The National Health Insurance will provide a comprehensive range of health services at all levels, from primary to highly specialized healthcare. However, it will exclude elective cosmetic surgeries, certain expensive dental and eye care procedures, and non-essential medicines. Now listen to this. Quality assurance under the NHI will be achieved through improved public healthcare infrastructure and management. An independent Office of Health Standards Compliance will be established to oversee adherence to the core standards, including cleanliness, reduced waiting times, and safety. This office will ensure that the public health facilities meet these standards through inspections, certifications, and addressing public complaints. Private healthcare providers can choose to contract with the NHI provided they meet specific quality and pricing standards. But will these measures be enough to maintain high quality healthcare across the board? Now listen to this. Critics often argue that the NHI is an expensive system, but it is designed to be more sustainable than the current healthcare model, which is both costly and benefits a limited portion of the population. In principle, a large single-payer system should be able to negotiate better deals than several small players. However, will this theoretical advantage hold up in practice, especially given the unique challenges of the South African healthcare landscape? South Africa's proposed NHI system is sometimes compared to systems in other countries such as Canada, the United Kingdom, and Thailand. Canada has a similar system, except it has 13 single-payer systems for each of its provinces and territories. Thailand, often cited as an example of NHI, technically has 3 funds rather than 1, although it resembles South Africa's NHI plans in several other aspects. Now listen to this. Funding the NHI is a significant challenge. The government proposes introducing a payroll tax on employees, raising personal income tax, and ultimately capturing much of the roughly 250 billion currently spent on private medical aid. Last year, Discovery estimated that the NHI would cost about 859 billion rands for prescribed minimum benefits, against a 2023 healthcare budget of just 233 billion. Now that leaves a shortfall of 626 billion rand. How will the government bridge this gap? And what will the cost be to taxpayers and the economy in an over-leveraged tax economy? Listen to this. The future steps for NHI involve public consultation on the policy, followed by legislative processes. Piloting of the system will begin, and will be done in selected districts, focusing on strengthening the healthcare systems in areas such as management, infrastructure, and human resources. Despite these challenges, the NHI's bill passage on May the 15th, 2024 signifies a commitment to a radical overhaul of the healthcare system. But will this overhaul achieve its lofty goals, or will it stumble under the weight of its own ambition? The NHI seeks to transform the South African healthcare landscape by making it more inclusive and sustainable. It is designed to provide comprehensive coverage for all citizens, ensuring that healthcare is a fundamental right rather than a privilege for the wealthy. Although the funding of and implementation of the NHI is a significant challenge, it represents a crucial step towards achieving equitable healthcare access for all South Africans. As we move forward, it's worth asking, will the NHI be the solution South Africa needs, or will it create more problems in its wake? I think so. And that's it. I hope this deep dive left you with plenty to think about. But tell us, what are your thoughts on the NHI in South Africa? What do you think about the promises that it's seeking to deliver? And do you think there are too many hurdles to overcome? Let us know your thoughts in the comments below. And as always, do not forget to like, comment, and subscribe to The Listening Show for more thought-provoking content.